we've been very active in trying to improve public awareness on presenting early with heart attacks and with chest pain. While we realize that a lot of chest pain is not all cardiac related, there are many cases over the years that we found that patients present late, they sit at home, they think it's indigestion, usually it's the wives that push the husbands to come in and see medical attention. The patients that tend to come early are those that have had previous heart attacks, that recognize the symptoms, existing heart patients, and those that have been educated to know what is a heart pain, because they get chest pains that are not heart and chest pains which are heart. But the outcomes are better if you present early. So if a patient comes in early, within the first hour or two of the onset of their chest pain, can be seen and a diagnosis made early, then our intervention and treatment drastically improves the outcome, improves their mortality rate, which means less patients die, more patients live, and with better outcomes, so less damage to the heart. So time is muscle saved. If you come in early, you have a lot of your heart muscle that is saved as opposed to lost.
And symptoms people must look out for?
So it's the development of chest pain, a heavy pressure, tight constriction feeling across the chest, often precipitated by strenuous activity or exertion, but not always so. And if a heavy tightness or smothering feeling occurs, to seek prompt medical attention and to get an ECG done at least to start, and let a doctor examine and take a good history. And if the ECG shows an abnormality, then urgent and prompt referral to a cardiologist, whereby we take the necessary action.
It's a diagnostic angiogram, someone who's got probably a cardiac problem. You know, his preliminary test may have indicated that there could be an abnormality, or his symptoms indicate towards a possible heart problem, and we want to do the angiogram to diagnose whether he's got disease, and if he has, how severe, and then determine what he needs. So if there is a problem that we can fix with the stent, that will happen immediately. If there is no problem, the diagnosis may just be ruled out or excluded, then obviously we deal with it in a different way. And if it's a diffuse problem with a lot of calcium and technically we can't stent it, then we discuss surgery with him. So this is the first step, just to get a diagnosis. And then the rest comes after that. That's why they wait. You know, because we need to be able to discuss with them, and you also need to monitor them and know whether they're getting pain or not. So we just do a local.